What's up, everyone? Welcome back to Kinda Different, a podcast where we talk about dental innovation. We meet some of the best people in this amazing industry, and we talk about how we all together can make dental care and healthcare more human. I'm Dr. Matt Allen, CEO and co-founder of Different Kind, and your host for Kinda Different. And today I'm absolutely thrilled to have somebody who certainly understands what it's like to be on the clinical side of dental care, but also understands what it's like to be on the technological side of dental care. Somebody who really, I think, has a pretty good lay of the land in terms of how what we do as people who are developing technology in this space impacts what that feels like in clinical care, which is always super important. So Jessica Fowler, a good friend, somebody who I'm thrilled to know. Thank you so much for taking the time to join us. Jessica has been around, SaaS, but she's also been on the clinical side. Like I said, really just has a really good lay of the land. I also feel like, Jessica, I don't want to put you in a box, but I watch a lot of soccer. Soccer's like my thing, right? You always are looking for like guys coming up of like, who's going to be like the next superstar, right? And I feel like you're just kind of like the next dental superstar that like a lot of people in like 3 years are going to be like, oh yeah, I remember when, before she was like the VP of whatever at, this big company. So I feel like that's you. I feel like that's the track you're on. Really influential and somebody who, like, again, I'm just really excited to know. So thanks for taking the time to join us today. Why don't you start off? Just tell us a little bit about yourself, and then we'll dive into some questions.
Yeah, no, that's awesome. And you're, no pun intended, too kind with your intro there. No, I appreciate all those kind words. And I'm Jessica. I am, it's hard. It's hard to like introduce myself because I've been like so many places, but really I'm just a human. I mean, I'm just going to say that honestly, like just a human. I started out as a dental hygienist. Actually started in perio, so like kind of the hardest at first, and then went backward, but just got a really strong foundation for just skills like as a hygienist, and it carried over into other practices like GP practices. I wore like all the hats in private practice, mainly the IT hat. I've always had like this. Kind of a computer nerd, but always helped with, workflows and implementing new software into the practice. And I decided to take a leap of faith and really use LinkedIn, but, jumped into the world of dental SaaS and, took a short stint in SaaS sales, and then worked at Uptime Health, helping build their partnerships department. And now I am at Spear Education. So I just kind of go all over the place, but I'm passionate about everything that I do. And so, that's why I'm just going to introduce myself as a human.
Perfect. I love it. That's we will talk about how we can together, right, make this industry embrace that humanity. So,
Yeah.
let's start with kind of the innovation side of things. So you've, again, kind of been on both sides of the aisle, which I think is so important, so valuable, right? And I feel that way too, right? Like I think back all the time to what it feels like as a clinician to do something, all of those things. You talk about this, you kind of like sense of, hey, when I was a clinician, I found an interest in the technology and, those kinds of pieces, but you also describe yourself as a human, which I think is really important, right? So why is in dentistry currently, what's your perspective on like why being person-centered or patient-centered, is innovative? Like what feels cutting edge about that in the same way that AI feels cutting edge for so many of us? What feels innovative about being able to look a person in the eye and have a meaningful and real conversation with them in dental care?
Right. Yeah, no, that's a great question. I feel like honestly, I mean, it's it's accomplished through people. Yes, you have AI, you have all of the things, right? Technology, different software, Excel. I mean, we all hate Excel. You have all of that. But at the end of the day, like when innovation actually happens, I mean, it's carried out by people, by humans. And so I have an interesting take on like innovation in dentistry and with it being patient centered, because you're talking about an industry that, I mean, I'd say it if I wasn't a prior clinician still probably, but I mean, it's archaic. It's an archaic industry. I mean, so slow to move, slow to adopt. And essentially, if you think about it, like it's literally it's a world that's created on fear. Like everyone fears the dentist. No one, well, some people like the dentist.
Most people fear the dentist.
Most people fear it. So it's driven off of fear, and I think that that's kind of why maybe dentistry has just been so slow to advance, because that's such a negative thing, right? And so I feel like almost, having, which is really cool, just all the synergy, having, these people from the business, industry, like the corporate sector, and technology and finance, like all of these people kind of coming into the space, it almost, having their perspective, right, is starting to advance that innovation. I mean, I feel like you can only do so much within a dental practice, right? Like when you are patient facing, you can try your hardest, but when you have all these cool new tools, and I mean, that's what AI is as a tool, is you have all of this coming into the space. I think that it really does, it impacts not only the industry but also the patient as well. I think that it'll end up kind of lowering that threshold when it comes to just fear, like fearful of coming to the dentist, because essentially we're just equipping patients with more power, really. Like, I don't, am I allowed to say names like Overja, Pearl, like those
Sure,
people?
you can say
Okay,
whatever. You
okay.
can say whatever names you want.
All right, all right.
We've had Ward on here. Yeah,
Okay,
there's no CE being given out, so you can do whatever you
okay.
want.
Okay. Like you have all these things that are visuals, and patients see them, and like, as a dentist, we try to equip the patient with knowledge so they're more comfortable and informed. Like being informed makes an environment, less stressful. And so, yeah, I'm starting to ramble now, but long story short, that's kind of my take on your question, just with patient centered, focus on innovation. I think that it just all ties together, and it's coming together nicely, just with how the way things are moving.
Totally. Yeah, I think, maybe a few thoughts kind of based on what you're saying there. We had Matt McGaughan recently, and he was talking just a little bit about, like ultimately like organizational change still has to happen, right? And you can have the best tool, you can have, whatever. So to your point, to your original point, right? Like the people who carry this out are people, right? And I think that ultimately, that piece is super important. And I think another thing that, I certainly feel this, right, as, or see this, I guess, in the industry, is that your point around for a long time it was solo private practice was kind of the only way to go, right? And it's really hard to be the clinician and be all the other things, right? Something has to give. You can't like do everything. And so as the industry has brought in more folks to like actually run the businesses and run HR and do all the things that like need to be done in the same way that a hospital has those things, and a big medical group has those things, right? Is that you end up like having the time, space, energy, and the personnel to like actually be able to accomplish those things. So I don't know. I feel like that piece, really lends itself well to, all right, we know that those tools are coming that are going to advance the technology. Hopefully what that allows you to do is like sit down and be a better human,
Right,
right? In
right.
your interaction with the patient.
Yep.
Because if you don't, I think you're going to get left behind. I mean, that's certainly my perspective there, right? Of you got to get good at the technology, but it's not just getting good at the technology. It's going to make the human side even more important.
Right, right. No, you're exactly right. I mean, it literally, it opens more space for you to carry out those human interactions. Like it's so important. That's a really good point.
Cool. Well, I certainly appreciate your perspective there. One of the things that I always like to kind of understand too, just in terms of where innovation is, and different people are doing different things. So what's the thing that you're most excited about right now when it comes to dental innovation? What really is floating your boat in terms of, hey, this is something that really gets me excited in the morning?
The biggest thing that's exciting for me in dental innovation is just going to be the clinical side kind of opening up and being more accepting of practices around, data workflows, like that piece. Because, that's something that, I mean, becoming a very like massive advocate for, is just like the fact that, we have all of this technology, all these software, we say the word data, we talk about data, input data, but you know it's important. And it's kind of interesting. I've seen now being at, a few different SaaS companies and also having that clinical lens and knowing how the vast majority of dental teams and clinicians operate. Not very many of them are aware when it comes to, how important data is and or that technology side. And so I like it because everything that we deal with, especially in the dental office, is it's all data, you know, address, name, like perio numbers, like whatever. It's all data. And so I think that, one thing that's going to be really important and critical though is to really to embrace the innovation is going to be to also raise awareness on some issues within practices. I'm sure it happens just in DSOs as well. Like the quality of data going into these systems is so important. I've just seen it. Like it stalls out at a certain point. Like when you talk about like business success or end user seeing the value, seeing the ROI in your investment. And I feel like people right now are at this point where, yes, like innovation is going crazy, but like we're at a standstill. So you have businesses that are like wondering, why churn's so high or, scratching their heads, like what's the disconnect? Then you have practices, doctors that are frustrated because they just, paid for the software and they're not. I mean, you and I know, like most dentists are not very tech savvy, offices, all of that, right? And so like everyone's hesitant to adopt a new software anyways, but it's like once you're in it, and then you're just like, I don't even know why I like signed up for this, right? And it all stems just from the end user, the practices and the doctors and hygienists and front desk not understanding the importance of data integrity. And so that's something I think that's going to be very important to raise awareness on in order for innovation like where we're at to like truly thrive.
Yeah.
you know
Totally. Yeah. If you can't trust what's in the system, right, you can't act on it. You can't do the right things on it. And we can talk all you want about data interoperability and get it, all of the, the many ways that like data can use innovation within dental care right now. But if you don't have the right stuff in there, it's the same. It's the same as with AI in general, right? If you can get a really crappy answer if you give it a bad prompt or a very generic prompt, and if you give it a really good prompt, right, like you can get pretty specific and you can really refine it. So it's the same, right? Like we've got to be able to put good inputs in to be able to get
yeah.
the outputs that we want. So
Yep, exactly.
so yeah, love that perspective. Certainly really foundational, and I think probably underlooked sometimes when or overlooked. Sorry, not underlooked, underappreciated, overlooked when it comes to like how do we actually drive things forward here. So
Right, yeah.
All right, well let's learn a little bit more about you. So I kind of said, hey, this is Jessica when we're coming in, and she's going to be the next big thing in dentistry, right? And everyone's going to know your name and know your face and whatever. So let's learn more about you. One of the things that I always like to know from people, I love development and I love learning, and I love kind of the quest to always understand more about ourselves and get better, both in our jobs, but just in life. So when you think about, something that you're learning right now and like, how does that kind of form into like a goal that you might have for the rest of the year? We're coming into fall, it feels like a changing of season almost, it's just like, okay, cool. Got 4 months left. What's the goal for, that kind of, here's what I'm learning and here's like what I want that to, do for me over the course of the rest of the year. Let's say.
Yeah.
It doesn't have to be at work at all. If you don't want it, if you want to get on the personal side of things, hey, we're happy to hear about that. So,
Okay. So it doesn't matter. I can go professional or personal.
yeah, whatever you want to do, 100%.
Okay. Because this is universal. You can use it professionally,
Anyway, yeah.
personally. It's mindfulness. Mindfulness. Like it's powerful. It is so powerful. I'm not like I didn't just start learning. And I mean, it's different because you can like read an article or like see an article on Medium pop across and it's like talking about mindfulness and you read it and you're like, yes, no, that resonates. Learning is cool. I'm going to take a twist on your question though and say I'm going to put a twist on it and say like practicing. Like what am I practicing, right? Because I've been practicing mindfulness and it's like so beneficial obviously in your personal life but professionally too. I and it honestly just comes down to like just stopping, which I feel like we all have such a problem doing, really, like everybody does, but literally just stopping and like naming what you're feeling, like whatever emotion it is that you're feeling and that a lot of the times, I mean, we'll go the professional route, but like it's so beneficial just first for that like work life balance, right? Like cuz if you're not really like super stressed at work all the time, obviously that's good for you at home, vice versa. But like it opens up opportunity, really. When you slow down, name the emotion, just sit with it for a second. Like it gives you a different lens to whatever it is that you're looking at. I mean, you could be super excited about something, but for me personally, I mean, like you come across something at work that you're like, what? Like, what is this? Like, oh God, what do I need to do here? But like just literally stopping and sitting with it for a second, it, it makes a click in your head and you're like, oh, and then you start thinking about things outside of what you normally would when you're in that moment and you're letting whatever it is get the best of you. But yeah, so I mean like I'm a huge advocate first off just for mental health in general, but as far as like what I'm really honestly like putting a lot of my focus on is just practicing mindfulness because I learned a lot about it and you can learn something all day
Yep.
all week, all month.
Brain knowledge is not, lived experience, right?
Right, exactly. If you don't put it into action consistently, right, then I mean, it might work a little bit, but you're not gonna you're not gonna get those full benefits.
Reap the benefits. So do you have any goals specifically around it? Like, is there any like, hey, this is, if you don't,
Yeah,
that's not you, but if you do, share them. I would love to hear.
no, I mean, honestly, I think my end goal is just to. This is probably not even great for the podcast. I'm sorry, Matt.
Hey,
It's
that's all right. It's authentic, right? Go for
it's
it.
yes, yes. You know what? That's my goal is to stay authentic. You know what? Yes, that's actually my goal. I'm stealing it. So my goal is to stay authentic because as I've been practicing mindfulness and whatnot, it makes things more quiet. It kind of like quiets the noise a little bit. Um, you come to see that I mean, there are really great people out there. I mean, most humans are great. Um, but you see the authentic ones a lot better when things are quiet and those are the gems like and that's I mean that could be applied personally I guess but like I have my professional lens on because I feel like even looping it back to the whole innovation piece like you and different kind like I just don't understand why you guys aren't literally everywhere. Like,
We
because
will be, we
like
will be.
you
It's
will
where
be, you will
up
be.
and comers, right? You gotta
Yes,
have up and comers, right?
yes. No, but that's the thing is that like you are authentic. Like I could tell it from the get, but like the people like you and all the other ones out there, like y'all are the ones that are gonna really make change. And I think that's what it's about at the end of the day is just creating like massive change, especially in this industry, because there's so much room for improvement. So yeah, I mean, just my goal is to stay authentic because I see, authentic people and just it's worth it. It's worth it for sure.
That's a good one. Being
Yeah.
authentic is worth it for sure.
Yeah.
100% agree with that.
Yeah.
Well, let's like take some of that connection piece in terms of being mindful and being human and the innovation piece that we've already talked about, and kind of wrap it together, right? In this idea of making dental care more human. So one thing that I love to kind of think about is just our experience outside of dental care, because when you are inside of it, it's hard to, dissociate yourself from it. And so, what's one kind of formative experience in your mind outside of healthcare that you're like, wow, that was really good, or that really shaped me in a way that made me feel, that this is something that's really important or whatever. So just kind of like give us that, like, hey, this is something that I love that was outside of dentistry that was maybe somewhere else in healthcare that really said, hey, this is what we can do in dentistry.
Yeah, yeah. Okay. Yeah, no, I can do that. So let's see. Oh gosh. Yeah, I would say that one experience that probably stands out the most for me at least is, and I guess it's not too much outside of dentistry, but just the normal, medical office. You I don't know how to word this. So, not to get too in the weeds, but and I have to say this on the podcast.
Ooh, hey, look at that.
Yes,
Boom.
I know.
Boom.
I thought it might be on the screen. That's why I was
I
like,
know it's not. I don't have. Oh, here we go. Hold on. Look at this. Look what I got. So I'm going off camera for this. You got Be Kind. I've got.
love it.
Here we go. Boom.
Oh my gosh, I need that on my
Yeah,
car.
there you go. You can. I'll get you some of those. So give your shirt. Put your shirt on. Well,
Yes,
don't,
yes, yes,
put your
yes.
shirt so we can see it. That is a much more appropriate way of saying what I'm trying to say.
Yeah, yeah,
There you
yeah.
go. Yes,
There
there
it
you go.
is. There it
Love
is.
it.
Be kind, be
Okay,
authentic, be kind.
there you go.
Yes, no, I love it. I love it. So as far actually no, let me get out of healthcare because that's
Great.
initially what I
Yeah,
said.
that's great. I love it.
Okay. So, oh, you know what? I'm going to take it back home to my husband. Okay, he's a firefighter.
Uh-huh.
He's a fire captain.
Okay.
They as far as training goes, I thought actually it's okay, now it's clicking. All right. So, one thing that I've thought of multiple occasions is the camaraderie that because it's I mean they call each other brothers and sisters, but that's always been like such a tight knit community, but it's not just like when they're, in the firehouse like or eating or whatever, but like it goes into like even their training. My husband, he put together a program for like new rookies coming into the department. And the way that they operate is just so I don't even want to call it team oriented, but like I've thought multiple occasions like God, why do we not like why do not just even in the dental practice. I mean, yes, it can apply there, but just even just within, a company, why are we not that close knit? Because I mean, their job. I mean, they're running into buildings that are burning down, like saving people in them, whatever it might be, like their position is high stress, like higher than you and I will experience. Even back in the day when we were in the dental office, when you like feel like you're in a building burning down, but they're able to keep that tight knit, like just that camaraderie. I want to say like love for each other
Yeah,
in
yeah.
like any instance. So when he was putting together this training program, it was like the first lesson almost to these new rookies was around like the brotherhood. And that's what they call it, the brotherhood. I know that there are female firefighters, but
Yeah,
just brotherhood.
yeah.
And starting with that, it makes everything else, from what I can see and like what I've heard from him, flow a lot easier. And again, just such high stress situations. But when they start with like we're a team, like we're a brotherhood, like we're together, it's not like they're not separate, it's so strong, like, and everything else after it, I mean, yeah, you have hiccups and bumps in the road, but like the environment is just it's crazy.
I love
So
that.
yeah,
Well,
that's a unique, sorry, I kind of
no,
went
very
like
good.
rogue on that one, but
I like it. No, I think that there's a lot that we could learn, from the idea of what kind of culture that is and what that
right.
feels like, right?
Right.
for those, firefighters, and how that then translates into how they interact with people, right?
Right.
On the street, and, in these places, wherever they're going to do their job, right? I think it really matters, right? And so it's hard to love your neighbor, right? If you're, not having that kind of strong foundation where you're like, I'm known, I'm seen, I'm loved, by my work colleagues, right? In the appropriate work kind of way. So, yeah, no, I think that's a really interesting insight. And I think that there's probably, you know, I bet I don't know, but I would guess that like someone has done some research on, that kind of like idea of like, what does that look like in fire culture, right? My brother-in-law is a fire chief in Denver. Actually, when I was driving into work today, they were doing the fill the boot, out in
Yep.
so,
Yep.
so yeah, all that to say, I bet there's some pretty interesting insight into
Yeah.
like how that actually impacts their life and how they think
Right.
things.
Yeah.
Something
No,
we can learn.
that's awesome. Yeah. But yeah, sorry. Yeah.
You're good. All good. Cool. Well, one of the things that I always say, like, I feel like we could talk about these things for a long time
Right.
because
Right.
we care about them. We think about them all the time. And we also want to create a, experience where people can listen to a podcast on their way to work or whatever it might be. So if people want to get in touch with you and kind of chat more, understand more about Jessica, learn more about, what you care about, whatever it might be, how do they get in touch with you? Where should they go?
Yeah.
Give us some details.
I would say your best bet would just be reaching out on LinkedIn. Jessica with an H at the end. Okay. Not, it's still pronounced Jessica, but throwing that out there. And then last name Fowler, Fowler. But yeah, no, just reach out to me on LinkedIn. I'm sure if you're, watching this, we've probably connected, but just shoot me a message. Yeah, I love to connect with anyone and everyone. So just
Perfect.
holler at me.
Awesome. Well, thank you so much for taking the time to come on. Thanks for the conversation. We really appreciate it. And yeah, I know that as you continue to become more ubiquitous within the dental industry, right? People will look back and they'll be like, oh yeah, like I know her husband's a firefighter now, and oh yeah, like I know she cares about mindfulness, and she probably has practiced that today, right? Like people will know more about you, and hopefully that will benefit everyone, right? That's always one of our goals here, is to create those connections even outside of an actual human to human.
Yeah. No, I love it. I hope. Please, somebody one day be like, are you still authentic? I'll be like,
Yeah.
hey.
Yeah. Hey, there you go. Love it. Sweet. Well, thanks so much for taking the time today, Jessica. We really appreciate it. And we'll look forward to talking to you soon.
No, thank you so much, Matt. Thank you.